My name is Haley Ketter. My passcode, my student ID number is 3384114. This is the fall 2019 semester. This is the canine lateral recumbency lateral saphenous venipuncture. For this injection, you will be injecting in the saphenous vein, which is located in the hind leg on the outside. So for this injection, what you want to do and restraint is you want to hold with one hand the front legs and keep the head up in this position, and restrain the other leg that you will need for the injection at the stifle, and you want to occlude the vein at the stifle right there. Lateral recumbency means that your dog needs to be laying on its side and in a relaxed position. After the injection is complete, what you want to do is put pressure on the injection site for at least 30 seconds to avoid hematoma or blood. This is the canine cephalic venipuncture sternal restraint. For this restraint, the vein that you're looking for is located on the front leg of the dog on the forearm. What you want to do for this restraint, since it's sternal, you support the chest and head area. You want to keep the head up to make sure that the dog can't react when you do the injection. With your other hand, what you want to do is support behind the elbow so that they can't withdraw when they're being injected. And also occlude the vein with this hand and twist the skin so that the vein is on the forearm. And once you are done with the injection, you want to put pressure on the injection site for at least 30 seconds to avoid a hematoma or bleeding. This is the feline medial saphenous lateral recumbency venipuncture. For this restraint, you want to grab the cat by the scruff and make sure that the top hind leg is in an abducted position and you are restraining it, while at the same time you put pressure on the lower leg on the inside to occlude the vein, and somebody else is going to need to be holding the paw to make sure that the cat cannot withdraw his leg during the injection. Afterwards, what you want to do is make sure that you put pressure on the injection site for at least 30 seconds to avoid a hematoma or bleeding. Lateral recumbency is laying on his side in a relaxed position. This is the feline cephalic venipuncture sternal restraint. For this, what you want to do is do the same thing as you would with the dogs, and you want to restrain the chest area and make sure that the head can't come down and bite when you're doing the injection. You also want to make sure that you keep the elbow so that he can't withdraw it throughout the injection. Then you want to occlude the vein with your forefinger and thumb and twist the skin so that the forearm, and it's easier for the injection. Once you do the injection, what you want to do is put pressure on the injection site for at least 30 seconds to avoid any hematomas or blood.